Okay, so one of the most important parts of your program here at Valley Physical Therapy and Sports Performance is retraining normal movement. So what we're going to do in these short video segments is I'm going to show you how to stand while properly shifting your weight through the left leg, and I'm going to show you how to sit while properly shifting your weight through the left hip. Okay, and so during this time, I'm going to tell you to get in a certain position, feel certain muscles. The really cool thing is you should be feeling the same muscles the same way you do during your exercises. So in the end, what our goal is in the long run is that we want you to not have to do exercises as much. We want to retrain these movements and incorporate them into your daily life. So first, let's look at standing. So a lot of times coming into the clinic, a lot of people will present in what we call a left AIC pattern as described by the Postural Restoration Institute. And so what this will look like is when a person will stand on their right leg, they will twist and turn their hips to the left so their zipper of their pants or the seam of their pants is facing their right great toe. At the same time, if you ask the patient to reverse this and put their weight on the left leg and shift their weight to the left, instead of twisting and turning the hips to the left, what will happen is this zipper will still be turned to the right and they'll stick the hip out instead. So what we need to do is we need to retrain twisting and turning those hips to the left, shifting our trunk over the left and putting our weight directly through that left leg. So what that looks like is stand with your right leg slightly in front of your left. We're going to put weight on the left heel and on the right arch. And when I say put weight on the right arch, what I mean is push your foot, the arch of your foot specifically, into the arch of your shoe. As you do this, you should notice that your hips twist and turn to the left a little bit. The other thing that you can think about doing in this position is push your right knee slightly forward, pull your left knee slightly backward. When you do this, it's important to make sure that you keep your knees soft, don't lock them out. You should now notice in this position, my zipper is turned to the left, the way that it was when I was standing on my right leg. So what we're going to do in this position, make sure I can feel my left heel, my right arch. I should also start to feel some muscles working, like my left glute med, my left back pocket area. I should feel my right outside of my hip, and I should also feel my left groin. The one last thing we want to make sure that we do is we want to make sure to shift the upper body over the left leg a little bit so we can feel our left abdominal muscles kick on. In this position, you're just going to breathe in through the nose and out through the mouth, and it's going to help retrain proper left stance. You can incorporate this into just standing throughout the day. For me, when I'm working on a patient standing at the table, I'm standing in this position as I lean down. It's a great way to incorporate this movement retraining into everyday activity. Next, we're going to cover sitting. Okay, so there are a couple considerations we need to make with sitting. First, we want to make sure that the knees and the hips are near a similar height because this allows the back to relax and be in a more neutral position. I will show you this from a side view in a moment. So basically what we're going to do, knees, hips level, we're going to slouch or relax the low back end of the chair. We should feel back support from belt line to mid back. Now, when you're sitting in this position, I just want you to become aware of your ischial tuberosities or your sit bones, the bony part of your butt, essentially. When you're sitting here, do you feel that the weight's pretty even between the two of them, or is it more toward one side versus the other? Most commonly, with patients that come in with that left AIC pattern, they will feel that there's more weight on their right sit bone. So once we're in this position, knees, hips level, and you've decided which side that you feel more, we're going to work on making sure that you become more aware of that left sit bone. So if you look at me, I should be in a pretty neutral position. Now, as I start to load weight more to my left so I can feel that left sit bone a little bit more, you'll see my body slightly bend to the left. This does not need to be a big bend. A lot of times I will tell my patients, relax your left arm on your thigh while your right arm stays on the armrest of the chair. This a lot of times will be just enough to shift that weight to the left. Once you're in this position, you're going to work on an exercise that we've practiced in the past, your adductor pullback exercise. So what that looks like is Feet will stay where they're at. You're going to push your right knee forward and pull your left knee back. As you do that, you should feel your left groin start to work, and you may even feel the outside of your right hip working. Once you're in this position, you're going to take 4 deep breaths in through the nose, out through the mouth. You can even just hold this position while you work throughout the day. Once those muscles start to get tired, rest, relax them. This is something that you can easily incorporate into working at the desk throughout the day. So again, we're cutting back the need to do exercises all the time because we're actively retraining our body during everyday activities. So again, weight slightly to the left, shift the right knee forward, left knee back. You should feel left groin working. You should feel your left sit bone or your ischial tuberosity, and you should feel your left abs working a little bit as you lean to the left just a bit.